Good afternoon. Mike Jones, Fire Chief, City of Fredericksburg, here for the latest update of what the City of Fredericksburg is trying to do to help with the COVID-19 crisis and to limit your exposure and stop the spread of the virus. First, the statistics. As of noon today, 770,000 confirmed cases of COVID-19 in the United States. 658,000 of those are currently active. And unfortunately, we have over 41,000 deaths of persons in the United States from COVID-19. In Virginia, we've really ramped up our testing. When I came to you last week, we talked about how about 48,000 people being tested. Now we're up to 56,000. So we've tested quite a few more people. And we now have almost 9,000 presumptive cases. 1,500 of those have been hospitalized at some point, not necessarily all at one time, and unfortunately we now at the 300 mark for a death toll. In our immediate area, we're now up to 287 positive cases in the Rappahannock Area Health District. Stafford leading the way with 161, Spotsylvania at 77, King George at 18, Caroline's increased 1 to 14. We had no new cases overnight in Fredericksburg. We're still at 17 cases. We did increase 13 cases since yesterday. That is down a little bit. We have been running somewhere between 17 and 22, so we're down a little bit there. As you can tell, testing is ramped up. Mayor Washington Healthcare is able to do some testing now as well, so I think you're going to see the numbers increase both in those people tested and those number of people that are positive. Doesn't necessarily mean that they'll all end up in the hospital or a statistic, but they'll certainly be there. Positive tests, again, are running somewhere between 13 and 15% statewide based off of positive cases versus the total number of people tested. We still are one of now only 2 health districts in the entire Commonwealth that do not have an outbreak, the other one being Western Piedmont down along the North Carolina line. Hospitalizations in the district are running somewhere between 50 and 70 people, depending on which statistic you pull and from where you pull it. Let's talk a little bit about kids today. Many of you have children or care for children. They may be struggling to make sense of what's happening and why the world has changed so dramatically in the last few weeks. So some things you might find helpful when caring for your children. Discuss what is happening honestly but simply. Don't overwhelm them with too much information. Monitor your child's reactions over time. They may change, and that may be something that you have to be keyed in on and understand. Listening is the key. Avoid discounting or minimizing any of their feelings. Understand where they're coming from and trying to sort all this out. Maintain a daily schedule while at home can support and stabilize stress reactions. Normal routines do help. Talking, writing, and art are ways children express their reactions. You want to encourage this. Get them engaged, get them doing things, whether it's talking about different things, writing, creating art projects, whatever. Provide reassurance about fears and safety. Remind them that what is being done is done to keep them safe. Monitor and limit your child's exposure to the media exposure of this event. There's so much out there in the media, and it can all run the gamut from good to bad, so just try to limit that exposure. And then tell them during crisis to look for the helpers. That's what Mr. Rogers always said. Look for the people that are helping. People like first responders, healthcare workers, all those people out there doing good things, people making face masks for the public, everything like that. Remember, city government is still open and functioning. Usually electronic means work best, but you can take some limited information via mail or telephone calls. We're available at the city manager's number, 540-372-1010. That's 540-372-1010. Or we're always available at www.fredericksburgva.gov. Please keep up your good personal hygiene and social distance habits. They are helping the situation and making things better. Thank you.